Hello and welcome to another episode of Keeping London Healthy. My name is Dr. Mario Elia. We've got a great episode lined up for you today where we're going to be talking about the liver with hepatologist from Toronto, Dr. Hemant Shah. And we're going to be talking about fatty liver and hepatitis and some other interesting liver questions that you may have. We'll be right back after this message. All right, welcome back. And again, I'm pleased to be joined today by Dr. Hemant Shah, a liver specialist from Toronto from University Health Network. Thanks for joining us today, Dr. Shah.
Thank you for having me, Dr. Elia. Happy to be here.
Excited to talk about a few common liver issues that we see in family practice. And I know a lot of our community members have some questions about. So the first thing we'll ask is about a topic called fatty liver, which I know some patients out there have encountered. So the common scenario for a patient is they get an ultrasound done for abdominal pain. Their doctor sent them for an ultrasound and they get a call back that good news, everything's fine. But you've got this condition called fatty liver and the doctor says not to worry about it and tells you to exercise and eat well. And it's kind of left at that often. And patients I often find are kind of puzzled after, what is fatty liver? And they didn't really get a good explanation. So Dr. Shah, if you can tell us a little bit about what is fatty liver in your own words?
Very common clinical scenario. Probably the most common incidental finding, which means, something else that's just discovered when you have an ultrasound of your abdomen, is a bit of fat in the liver. The liver is the body's fat factory. So think of it as the place where all of the carbohydrates, sugars, fats, lipids that you ingest and then digest, they make their way to their liver. And the liver's job is to package it, to process it, to prepare it to be used as energy in other parts of your body. Now, when a person has a diet that might be high in fats, might be high in some very simple sugars, such as fructose, what ends up happening is the liver converts a lot of those sort of base materials into triglycerides. And those triglycerides get stored as fat globules in the liver. And that is what we call fatty liver. And on an ultrasound, it's actually really easy to see because fat is very, very bright and the liver is very, very dark. So it's kind of like this perfect contrast medium, and we see that fat being deposited in the liver. Now, what is the significance of having fat in your liver? I think that's probably what, listeners out there and viewers want to understand. Well, the good news is that for most people with fat in their liver, it doesn't cause a liver problem. But the fact that that fat is there in the liver means that it's also in other parts of your body where it's not so easy to see. And the concerning parts of the body would be the blood vessels that go to your heart, that go to your brain. So really that fat in the liver, think of it as a signal or a way to see the risk that is developing in your heart and your brain for cardiovascular disease. Now, in a small proportion of individuals who have fat in their liver, it can actually irritate the liver, cause inflammation, and over the long term cause injury. And that injury can lead to cirrhosis of the liver. And those are the people that I see in my practice.
So you mentioned the kind of cirrhosis as a possible complication. How common would you say fatty liver is overall? And for those patients diagnosed with it, what can they do? What are some options?
Yeah, so fatty liver is very common in society. If I stood at the corner of the street in any street in Ontario and did an ultrasound on every person that walked by, I'd probably find about 25 or 30% of people have some fat in their liver. Mm-hmm. Depending on the jurisdiction, the area that you're in, and what the prevalence of obesity is there, like how overweight people are, you're going to have more or less fatty liver. In some of the most overweight regions of the world, which are mostly down in our neighbor to the south, 40 to 50% of the population has fatty liver. Mm-hmm. So it's very common. And it's not a totally unexpected finding when we see it. 25% of people will have fatty liver. A very, very small proportion of those individuals will ever go on to develop liver problems. So out of that 25%, over their entire life, maybe only about 15 or 20% will develop liver irritation, and an even smaller proportion will develop cirrhosis. So while overall it's the numbers are pretty large. As a proportion of people that have fatty liver, not a lot of them are going to develop liver disease. Now, when I talk to my patients who have fatty liver, and I talk to them about what can be done, the best treatment for fatty liver, proven time and time again, is, losing weight through healthy living, including, better diets and more activity and exercise. That is the sort of fundamental treatment of fatty liver, because not only does it treat the fat in the liver, if you lose weight, eventually that fat will reduce in amount or even disappear completely, but it treats the fat that we don't see in those other places that are really important, like blood vessels to the heart and the brain.
And alcohol reduction, important for these patients as well, would you say?
Well, alcohol is an important cofactor for all liver diseases, whether we're talking about fatty liver or viruses or something else. And when people consume excessive amounts of alcohol, and for women, we would define that as more than 1 drink a day, and for men, more than kind of 1 to 2 drinks a day on average. When people consume more than that, it can actually have kind of a synergistic effect with other liver diseases. So it's like not 1 + 1 = 2, it's more like 1 + 1 = 3. And so I like to encourage patients who have fatty liver to reduce their alcohol consumption, usually to 1 drink a day or less. And if they do have liver damage from the fat in their liver, then in some circumstances, I'll actually try to help them move towards complete abstinence from alcohol. Alcohol, unfortunately, is a poison for your liver. It's just, fortunately, most people take it in small doses, so it doesn't cause a problem. But when people consume a lot, it can injure the liver significantly.
And evidence for a lower carb diet versus just a Mediterranean diet for treatment of this. I know some hepatologists will have, different strong opinions on this. What would you say about this?
I mean, the best evidence all points towards a Mediterranean diet. That is, in a way, a low carb diet. I mean, it's not a keto diet, right? So I think there's a distinction. And I'm not an advocate for keto diets, mostly because they're not sustainable. And the ketosis has maybe a beneficial short-term effect, but in the long term, those patients actually probably have worse cardiovascular outcomes. The Mediterranean diet, on the other hand, is kind of it's a nice diet. When I talk to patients about it and they ask me what it is, I tell them, look, it's more white meat than red meat. It's more vegetables on your plate than meat. And it just is a little bit usually lower portioned food quantities. So on the whole, you can kind of see it's got all the right elements for being a very good diet for people to take. And actually, for people with fatty liver who can adhere to a Mediterranean diet and lose weight that way, it has the best evidence for showing that the fat will disappear.
And what kind of follow-up does the average patient need? So they're told they have fatty liver by their doc. It's kind of brushed off as just an FYI type thing. But is there any follow-up that these patients should be asking for their docs if it's just incidentally found?
Yeah, I mean, I would hope that it's not initially brushed off. Maybe that's the first thing I would say. I think after it's recognized, the best thing to happen for a person is for just an initial evaluation to take place to see, are you the person, the 1 out of 50 or 75 people where it's causing a liver problem or not? And if that's the case, then you probably need to see a liver doctor like me relatively soon. Or you're like the person where it's not causing any liver issues. It's a signal about cardiovascular risk. And in that case, how does it need to be followed? It probably only needs to be followed once every year or two. You don't need ongoing ultrasounds to monitor it. It's just a matter of having really good primary healthcare, attention to detail about your cholesterol, your blood sugar, and management of those issues if they're present or if they should arise.
And we talked about finding these cases incidentally on other imaging. Any evidence for screening, in patients who have certain risk factors? Should they be pushing for an ultrasound, or is there any good evidence for that?
So probably the United Kingdom is the most advanced in studying whether or not population level screening is going to be useful. So right now, I can't advocate for the entire population to be screened for fatty liver. Mostly because even if we find it, for the vast majority of people, we already know they have cardiovascular risk factors. So our advice to them isn't going to change. And you've just spent a lot of money doing ultrasounds on the population.
Yep.
That being said, for some specific populations, it is emerging that there is a good reason to do this screening. And probably diabetics would be the number one population where screening for fatty liver is a useful thing to do, because they have a higher risk of having liver damage from fatty liver if you have diabetes. And secondly, it might alter your diabetes management. You might be more likely to use diabetes therapies that induce weight loss rather than weight gain if you have fatty liver, because it's possible that you could be treating not only the diabetes, but also the fatty liver with those medications.
Perfect. Great. We're just going to take a quick break, and when we come back, we're going to talk a bit more about liver disease, specifically about hepatitis when we come back. Welcome back. Again, we're being joined today by Dr. Hemant Shah, a hepatologist, so liver expert from University Health Network in Toronto. We're going to switch course a little bit to talking about hepatitis. So Dr. Shah, can you tell us a little bit about the differences? People have heard about hepatitis A, B, C, a bit of an alphabet soup. Can you tell us a little bit about the differences between these?
Sure. So there are many hepatitis viruses. What a hepatitis virus is a virus that primarily affects the liver and then replicates in the liver. So they're named sequentially in the alphabet, A, B, C, D, and we're up to E now. They are related in that they are sequential in the alphabet, but they're more like apples and oranges in how different they are. So hepatitis A is a virus that we really only hear about in outbreaks. It's transmitted what we call by the fecal oral route, which means by contaminated things that you touch, and then you touch your lips or your mouth, and you ingest the viral particles. And it typically causes an acute hepatitis, meaning it causes an acute illness in a person where their liver tests become very abnormal for a short period of time, and then usually they recover. Very rarely they do not recover. That virus, so hepatitis A, is very different than hepatitis B and hepatitis C. Hepatitis B and hepatitis C both cause chronic hepatitis, meaning you become exposed and infected, and then the virus stays with you for a prolonged period of time, sometimes your entire life. And those viruses are transmitted in a different route, which is through bodily fluids. So they are sexually transmissible, and they're transmissible through blood exposures, like through the use of injection drugs, sharing needles, or transfusions, as an example. Hepatitis D, or what we call Delta virus, is a virus we really only think about in the context of hepatitis B, which is the much more common virus. And I probably don't need to talk a whole lot about hepatitis D. It's an incomplete virus. It's kind of an academic. It's of academic interest, but we don't really have any of it in Canada, very little. And then hepatitis E is similar to hepatitis A in that it causes outbreaks of hepatitis. It's transmitted, again, by ingesting it, fecal oral transmission, and is associated with outbreaks primarily related to eating undercooked pork. So it's a virus that has an animal reservoir. And the outbreaks associated with hepatitis E can be very dangerous for women who are pregnant. So it is sometimes thought about in that context. But again, that is a very, very uncommon virus in Canada. I can't remember the last hepatitis E outbreak that we've had.
Great overview of kind of the landscape of hepatitis. So I want to focus more on the B and the C. So the ones that can cause chronic hepatitis. The reason I want to focus on them is that's where we can really kind of make our biggest impact. If we can find them, treat them, we can really save some lives and do some good work. So we'll talk a bit about that. Let's talk about C first, so hepatitis C. So tell us a bit about screening first. So like, who should be getting tested for hepatitis C?
Yeah, so hepatitis C is a virus that causes an infection, and the person who has it almost certainly will have no symptoms, and they will have no idea that they have it. Routine blood testing is not going to pick it up. So we actually need to go out and test people who are at risk for hepatitis C with a specific hepatitis C antibody test to see if they've been exposed. So who are the individuals that are at risk? So the first risk group that I always talk about for hepatitis C, which is probably the largest risk group in Canada, is every individual who was born between 1945 and 1975. Individuals who were born in that period of time have an independent risk of having hepatitis C because they were born and raised in a period where hepatitis C was circulating in the community, but we actually didn't even know it existed. And like when you go to the hospital now and we're always, every needle is opened out of a package. I mean, people who were born in that era will remember that, you know, they were often reusing needles. There were a lot more glass syringes, so they were cleaning things in between, and a higher risk that blood-to-blood transmission was happening just by medical or dental interventions. So that group of individuals, once in a lifetime, should have a hepatitis C test in Canada, and you can see your regular physician or nurse practitioner for that. The other groups are individuals who have specific risk-associated behaviors. Actually, I should add, there's one other group as well, but maybe it's not a risk behavior. So the other general group would be people who were born in a part of the world where hepatitis C is very common, and they could have been exposed, as a child through a vaccination or something like that. And the parts of the world where hepatitis C are quite common are Northern Africa, especially Egypt, Southern Europe, Greece, parts of Italy, and Asia, actually. So if you're born in one of those regions, you should have a hepatitis C test. The other groups that should have testing are really groups with risk factors. So people who've used injection drugs or are using injection drugs even just once in their lifetime, those individuals should be tested. People who've engaged in high-risk sexual behavior, especially men who have had sex with men, very high-risk group for acquiring hepatitis C sexually, so they should be tested. And then individuals with a lot of regular interaction with the healthcare system for over a long period of time, you should probably have a hepatitis C test at some point.
Perfect. And for hepatitis C testing, again, just because you had liver testing with your doc and it was told it was normal, does not necessarily mean that they actually tested you for hepatitis C. So you have to ask specifically. And even in my practice, that age cohort, we've caught, we know 1 or 2 patients with hepatitis C. Again, those individuals, it was based on where they were born in the world, but caught hepatitis C and they had no idea they had it because they felt fine. And was important to treat. And treat for those who have Hep C or they've known people who've had Hep C in the past. Treatments now are very different than they were even 10, 15 years ago. Much fewer side effects, much more effective. And really, once someone is cured of hepatitis C, provided that they didn't have any cirrhosis, they're effectively cured, and we'd consider them no higher risk than anybody else for long-term liver damage. So really important to be finding this early. Switch course a little bit to hepatitis B. So again, can you tell us a little bit about screening? I know same kind of framework in terms of country of origin and risk factors for that.
Yeah, the most common route of sort of getting hepatitis B in the world is people who've acquired it vertically from their mother when they were born, and they've had it for their whole life. So actually, as it turns out, the major risk factor for hepatitis B, I mean, first of all, is if you have a family member with hepatitis B. But the second major risk factor for hepatitis B is where you were born or where your ancestors were born. And if they were born in a region of the world known to have a lot of hepatitis B, then you need to be tested for hepatitis B. Because just like hepatitis C, you can have no symptoms, your routine liver test can be perfectly normal. And unless a specific hepatitis B test is done, you wouldn't know that you have it. So where are those regions in the world where there's a lot of hepatitis B? Turns out that there's a lot of overlap with regions that have a lot of hepatitis C, but specifically all of Asia and Southeast Asia especially. So in China, a country of over 1 billion people, the prevalence of hepatitis B is probably 5 to 7% of the population. So tens of millions of people with hepatitis B, many of whom don't know it. Lots of hepatitis B in Africa. In fact, Africa is probably the only place in the world where a number of people with hepatitis B continues to grow because of unfortunately incomplete vaccination programs. Hepatitis B is a vaccine preventable disease. There's a fair amount of hepatitis B in Eastern Europe and some pockets of South America. So a lot of the world is at risk for hepatitis B. And I think, if you're a person out there, you recognize that you're from one of those places, ask for a hepatitis B test. You're probably not going to have it. But if you do, then you need some monitoring and possibly some treatment.
Absolutely. Yeah. Rule of thumb, if you were born outside of Canada and you had to cross an ocean to get here, you probably should be talking to your healthcare provider about getting hepatitis B and C testing done. And,
Yes.
and that age cohort, again, for hepatitis C, just to clarify, with people, if you're born between 1945 and 1975, we're using as our range.
Yes. Yeah.
So 1945, 1975, if you never had a hepatitis C test, again, chances are you're not going to have it. I can tell you in my practice, we've tested, hundreds of people and we found a couple cases. So you don't have to, it's not a huge concern, but it's something we don't want to miss if we can find it. In terms of vaccines, so important people to know that there's no vaccine for hepatitis C, but certainly for A and B, there is an available vaccine. If you just chat about that really quick.
Yeah, absolutely. So hepatitis A and hepatitis B are both vaccine preventable diseases. I would recommend them for every Canadian. They are available as individual vaccines. They are available as pediatric doses, and they're also available as a combined vaccine, which is commercially sold under the brand Twinrix. So any one of those are options. For people born in Ontario, we universally do vaccinate for hepatitis B. It's done in grade 7. But there may be circumstances where it should be done much sooner, even when a person is an infant, especially if they have a family member with hepatitis B as an example. So in those circumstances, having hepatitis B vaccine very early in life is important. For anyone who travels, hepatitis A vaccine is a must. And for anyone, honestly, anyone who even doesn't travel, we occasionally do have outbreaks in Ontario of hepatitis A, and it can be you can be prevented by getting sick if you've had the vaccine.
Perfect. Yeah, and I know obviously people haven't been traveling much for the past couple of years, and concern has been more heavily steered towards COVID. But certainly we can't forget about risk of hepatitis A, especially with A and B with travel that we can prevent with.
Yeah, and maybe I would just mention these are once in a lifetime vaccines.
Yeah.
So once you've had the full course of vaccination, they're not going to require repeated boosters and every period of interval of time that won't be required. So that's good news.
Perfect. We've got a couple of minutes left. We're just going to do a couple of quick hitters. Again, we've got a liver expert here, so we want to ask couple interesting liver questions. So people hear about liver detoxes all the time, supplements available to do a liver detox. What's your quick answer for those questions that come up?
My quick answer to that is the only thing that you're detoxing is your wallet.
Perfect.
So the liver as an organ has extremely sophisticated enzymatic pathways to be constantly detoxifying your blood, your lymphatic fluids, its own cells. It doesn't need any help, and it does its job. So I definitely do not advocate for detox regimens.
And have you seen much in terms of liver complications from people who take herbal supplements or?
Well, it's a great point, because that's absolutely the risk with a lot of these detoxification regimens that are out there. We in our liver program probably once every 3 or 4 months see someone who is extremely ill from a side effect or a liver injury, really, from one of these detoxification regimens where essentially they contained a poison to the liver. And we've had people who've required liver transplant, people with healthy livers that took a detoxification regimen ended up requiring a liver transplant because the regimen itself caused an injury.
One more question. Tylenol often comes up in liver disease, whether it's safe or not. So if patients don't have liver disease and they're taking the recommended dose of Tylenol, do they have to worry about their liver?
Yeah, so Tylenol is extremely safe for the liver when taken in prescribed and recommended doses. The way Tylenol causes injury to the liver is only when you exceed a certain amount of it, because at that point, your liver turns it into a toxic compound. But if you're taking, very safely less than 4 grams of Tylenol per day, if your liver is healthy already, you have no risk of injuring your liver. And so it is actually an extremely safe medication from a liver perspective. It's the one I recommend in my sick liver patients for pain control.
Fantastic. Thanks so much for all these great information today about the liver.
Thank you.
And until next time, stay healthy.